Esophagus cancer is a cancer that is on the rise in the United States. It is a cancer of the esophagus or the food pipe, and it can occur anywhere within the esophagus. So this is our esophagus as it comes from the mouth into the chest, and it goes a little bit into the abdomen right before it enters the stomach. The cancer can occur anywhere along the way. The most common area that the cancer occurs in today's age is the junction between the stomach and the esophagus, and it's been thought to be related to acid reflux or long-term exposure to acid reflux in that part of the esophagus. The treatments for these are based on the stage of the cancer. They involve either surgery, chemotherapy and radiation, or chemotherapy and or radiation alone. Esophageal cancer can be symptomatic. However, it is often at a later stage that it becomes symptomatic. The most common symptom being that it is dysphagia or the difficulty swallowing foods. It is because of the cancer causing a blockage in our food pipe. Cancer at an earlier stage can be detected in people who are undergoing surveillance for acid reflux or a pre-cancerous condition called Barrett's esophagus. Unfortunately, a majority of people presenting with esophageal cancer present with locally advanced cancer where the primary symptom is difficulty swallowing. The treatment of esophageal cancer is based on stage, much like most cancers of solid organs. Stage 1 is a cancer that occurs in the esophagus that is an early cancer that hasn't spread beyond where it started and is only in the inner layers of the esophagus. That is treated primarily with surgery without often any need for chemotherapy or radiation. Stage 4, which is on the other end of the disease spectrum, involves cancer that has spread to another part of the body away from where it started, namely the esophagus or the food pipe. That could be in the brain or the lungs or the liver or the bone. These folks are treated with chemotherapy as their primary mode of treatment, with radiation for symptomatic benefit, either from bone pain from metastases to the bone or from difficulty swallowing to help relieve the obstruction. Stage 2 and 3 involve cancers that involve deeper layers of the esophagus or have spread to lymph nodes in the local area. These are often treated with chemotherapy, radiation, followed by surgery. The operation predominantly involves resecting the esophagus, not just the area where it's involved. However, it often requires resecting most of the esophagus and using the stomach as a new esophagus or as a new tube to reconnect to a small portion of the esophagus that's left behind. This allows people to eat food that goes directly into the stomach and to the rest of the bowel. That allows the treatment of the cancer, resecting the area or removing the area of cancer, as well as restoring the person's ability to eat. The recovery from an operation of this kind is often in the order of 6 to 8 weeks and requires additional
Even at 70, it's hard to keep Ed Gardella off the softball field.
Oh, first day.
But when he was diagnosed with esophageal cancer, instead of stepping up to home plate, Ed had to step back. Even more than 30 years in law enforcement couldn't prepare him for this battle.
I was feeling kind of beat up during that period of time, but never once did I want to die. I just entertained the thought that, dying can't be as bad as this. Hey, what you got?
Like most people who get esophageal cancer, the disease caught Ed and his wife Elaine by surprise. The warning signs are common ailments most people initially ignore, like problems swallowing, chest pain or heartburn, weight loss, and fatigue. Dr. Peter Enzinger is Ed's doctor. He's an esophageal cancer expert at Dana-Farber Cancer Institute in Boston.
It certainly is not as common as the big cancers, lung, breast, prostate cancer, but it does occur in about 14,000 patients a year in the United States, and it seems to occur much more so in men than in women. So men have about a 10-fold higher risk of this cancer than women do.
After undergoing surgery, chemotherapy, and then radiation, Ed has been cancer-free for more than 5 years. Besides practicing his swing, Ed now spends his time mentoring other cancer patients, giving them the same support others gave him when he was going through treatment.
And she took both my hands and she said, "You keep on keeping on." And I thought about that a couple of hundred times. Even today, you keep on keeping on.
At Dana-Farber Cancer Institute in Boston, I'm Ann Dorr reporting.
Yeah, well, that's what they do. They have to keep people.
Living in South Florida, I'm sure that there's plenty of doctors that would be more than qualified to treat this, but when it comes to something like this one, it's a matter of life and death, or could potentially be a matter of life and death. I'm gonna find, I tried to seek the best doctors for this, and in the research that I looked at, Moffitt was at the top of the list every time. The staff here was incredible, and you know, I had obviously my support from my friends and my family, but the staff here allowed me first to understand what I was doing and why I was doing all of it. But it also made me feel, every time I walked in here, I'm incredibly spoiled now when it comes to coming here. You know, with all the patients that are here, it's amazing how I can walk in here and feel like I'm the only one here. The amount of the level of attention and service that I've gotten from the staff has been absolutely incredible, and the nurses and staff have been a godsend. I know that I'm incredibly lucky and blessed to have who I have and who I've had around me, and also the fact that, you know, I'm able to sit here and tell the story as well. I don't want to go to another doctor, even for simple things as getting blood works done or anything back home. I don't want to do it. I don't trust anybody else at this point. So if I have to drive over here and for 4 hours just to come in and say hello, I don't mind doing it. So if I had to drive further, I would have to do it. I'd still come here.
We treat benign or non-cancer disease processes, and as well as malignant or esophageal cancer. And so when we're talking about esophagectomy for the treatment of esophageal cancer, the way it was done before was with big incisions, you know, a big incision in the belly plus a big incision in the chest, or a big incision that went from the chest to the abdomen. Sometimes there's a neck incision. So really we're talking about big incisions for a big operation. And with the advances in technology and surgical technique, now we're at a place where we can do that operation, esophagectomy, with a minimally invasive approach, meaning small incisions, Band-Aid type incisions, which, you know, for the patient gives them the advantage of, you know, less pain, gets them up and moving around, gets them back to get home and to working sooner than before. So really there's multiple advantages to doing it with a small incision, but still doing those operations the same way it was done when it was open. As far as the benign esophageal surgery, things like motility disorders, hiatal hernias or diaphragm hernias, benign tumors of the esophagus, all those things now can be done with those small incisions.